So I'd like to welcome Dr. Shireen Kassam to Fever Radio. Shireen is a consultant haematologist and honorary senior lecturer at the King's College Hospital in London with a special interest in the treatment of lymphoma. She is also a visiting professor at the University of Winchester, Hampshire, where she has developed and facilitates the UK's first university-based course on plant-based nutrition. Shireen is passionate about promoting plant-based nutrition for the prevention and reversal of chronic disease and for maintaining optimal health after treatment for cancer. In 2019, she became certified as a lifestyle medicine physician and is also a CHIP facilitator. Shireen founded Plant-Based Health Professionals UK in 2018, a non-profit membership organisation whose mission is to provide evidence-based education on whole food plant-based nutrition. In January 2021, she co-founded and launched the UK's first regulated plant-based lifestyle medicine healthcare service, Plant-Based Health Online. Shireen qualified as a doctor in the year 2000. During her training, she completed a PhD, which investigated the role of selenium in sensitizing cancer cells to chemotherapy. Shireen has published a number of peer-reviewed papers in the field of lymphoma. Her first book, Eating Plant-Based: Scientific Answers to Your Nutrition Questions, co-authored with her sister Zara, was published in January 2022. She has also co-edited the textbook, Plant-Based Nutrition in Clinical Practice, published in September 2022. Welcome to Fever Radio, Shireen.
Oh, thank you very much for inviting me.
It's worthwhile saying that prior to our interview today, I've also interviewed Drs. Sundhya Raman, Tilak and Sagra, Dr. Olga Morton, and Dr. Alka Patel, all of whom have spoken highly about you and I believe are in some way a product of your efforts around bringing lifestyle medicine and nutrition into the imagination of medical professionals in the UK. So I'm very, 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 very proud of myself and happy to have you joining us here today and giving us your information. I guess I'd like to start the interview with asking you what motivated you to found Plant-Based Health Professionals in the UK.
Yeah, thank you. And a great collection of guests you've had already. They're all members of my organisation. So wonderful. So back in 2013, I adopted a plant-based diet and went fully vegan, really for the ethical reasons. But I soon realised that there were numerous benefits to overall health, both physical and mental well-being, through the adoption of a plant-based diet. And I started delving into the science, the evidence, the guidance around this, and wondered why I was learning most of this from US sources or Canada or anywhere outside of the UK, it seemed. And there wasn't at the time, certainly that I was aware of, a healthcare professional-led group that was supporting people to adopt healthy plant-based diets for the reasons we know a person might want to, whether it's animals, environment, their health. And so I set out to bring the information that I wish was readily accessible to me when I adopted a plant-based diet to the UK, and to empower doctors, health professionals, and citizens at large to feel comfortable adopting a plant-based diet and reap all the huge benefits that are out there for grabs.
I mean, actually, I became plant-based. I'd say plant-based. I'd say plant total or plant exclusive, as Chef AJ would say, in 2013 as well. When I was diagnosed with renal cell carcinoma, cancer of the kidney. And I was just amazed at when I started looking into the research. I couldn't believe what I was reading. I'm not a health professional by a long shot. Didn't understand much about health, certainly in the way that I do today. But I just couldn't believe the information that was out there, the research, the testimonials, the remarkable stories of recovery. And actually it became a mission of mine from then to try and get the message out there to the layperson as much as possible in a kind of digestible manner. So interesting that happened for you in 2013. So snap on that.
Excellent.
So I'd like to ask you why is lifestyle medicine needed?
Yes, so it's a good question. So the broader umbrella of lifestyle medicine aims to tackle the root cause of chronic conditions, of which diet and nutrition form one of the key pillars of lifestyle medicine. And if we go back to the rather alarming statistics in that lifestyle habits or behaviors, whatever you want to call them, are really at the root cause of about 80% of chronic conditions. So if we were all able and were to adopt healthy lifestyle habits, then we could wipe out 80% of conditions that we see every day in the healthcare service and the NHS here in the UK. And the reason I fell upon lifestyle medicine was because clearly diet and nutrition is a key pillar of a healthy lifestyle. And the founding organization of the lifestyle medicine movement, the American College of Lifestyle Medicine, has a position statement around diet and nutrition that clearly states, if we want to reap the greatest benefits from our diet and our meals that we eat every day, we should be centering our diet around healthy plant foods. And so I thought, well, I'm already passionate about one of the pillars of lifestyle medicine. Let's look into the rest. And, everything else is just common sense. It's regular physical activity. It's getting enough restorative sleep, maintaining and fostering healthy relationships, avoiding toxins like tobacco and alcohol, and taking care of our mental health and well-being. And it made so much sense because although you told your listeners correctly that I'm a hematologist and I look after people with a type of cancer of the lymphatic system, I see that my patients also have a number of other conditions that really could have been addressed sooner or even currently through the adoption of healthy lifestyle behaviors. And by immersing myself in the field of lifestyle medicine and getting that knowledge on board, I've expanded my toolkit and my knowledge for me personally, my family, and of course, importantly, to improve the outcomes for my patients.
So you're saying 80% of chronic diseases are lifestyle related. I presume that then means that the other 20% is genetic, or would they fall under another category potentially?
Yeah, it would be under other categories of genetic or accidental or infectious diseases, things that aren't eminently related to lifestyle behaviors. And I know you want to cover this, and maybe it's a good time to just mention it, that obviously lifestyle behaviors or habits are not always a choice that people actively make. Most of these healthy habits are often not accessible to everyone. So it's not about, blaming or shaming people. It's just about helping people to get the most out of what's available and accessible to them to enhance their health and well-being.
And so why, as we kind of touched upon at the beginning of the interview, there's all this litany of research and, examples of people who've recovered their health through adopting a lifestyle first type of approach. I mean, just going back a second, actually. You had these five pillars, isn't it, of lifestyle medicine?
6 pillars.
So what 6 pillars? My apologies. So what percentage? How important is food and nutrition within that?
I mean, I have a biased view, of course. I think it is the most important. And I do truly believe that, because unless we have a foundationally healthy diet underpinning everything, I think it's very difficult to reap the maximum benefits. And of course, eating and deciding what to eat and putting things on our plate is something most of us do several times a day, on average 3 times a day. So it's something that's part of our everyday. And so I think without that foundation, we can't reap the benefits of things like physical activity and restorative sleep, because to exercise well we need an excellent and well-balanced diet. To sleep well, we need to make sure we're also getting a good range of nutrients. So for me, diet and lifestyle diet is the key pillar for lifestyle medicine.
Okay, great. I think I would agree with that, but then I tend to have a little bit of a bias with that as well. Now, why do you think it's taken until now for lifestyle medicine to begin to be acknowledged as an approach to treating disease, given that the research has been available for at least 100 years? I mean, there's some remarkable studies, I think, by Walter Kempner, in treating chronic kidney disease in the 1930s. There's Nathan Pritikin's, research, I think in the 1950s and the early 1960s, going back as far as that, in treating our most common killer in the West, which is cardiovascular type diseases. So why do you think it's taken so long for lifestyle medicine to really rear its head in the way that it has in the last few years?
Another good question, and you really have done your research, so you do know that this lifestyle approach goes back decades. I think it's a difficult question to answer, and there's multiple layers to that. If we think about the core curriculum for healthcare professionals, the basis of that hasn't really changed considerably, and is very much based on the sick care model. You sort of are treating people, patients, whatever you want to call, individuals that come and see you once they've developed chronic conditions. And so the easiest thing and often the most appropriate treatments to reach for are the pharmaceutical interventions or surgical interventions or other technological solutions. I think we don't, as a nation, put enough emphasis into these preventative lifestyle habits or behaviours that will prevent disease. The National Health Service in the UK only spends around 5% of its budget on preventative care, and that includes early detection like cancer screening or things like the vaccination programme. So there's very little money in it. And then as a professional, it really is easier to prescribe a tablet or refer to a surgeon or such like, because it takes a lot of time and effort and energy and a different style of consultation to support people to change behaviors opposed to just taking a medication. Although it's also quite hard to support people to take medications, because we know that 50% of medications prescribed are not even taken by patients. So even that we're not doing terribly well. So I think a lot of the research out there now, the current research that is making very good advances in treating cancer or cardiovascular disease, is being led by the pharmaceutical industry, because that's where the money is. So they're driving the clinical studies because they can fund the studies, and therefore the research questions and therefore the answers that are coming out are very much in favour of using a pharmaceutical approach. So I think there's numerous reasons. And then, our current government use the excuse that they don't want to be a nanny state. They don't want to necessarily tell people how to live their lives or demand certain behaviours of people. So I think all of those factors feed into the fact that our healthcare system is sort of topsy-turvy. We wait for somebody to become unwell and then firefight the problem.
I mean, some people might say that the lifestyle approach is less profitable, certainly in terms of the common approaches we have to treating sickness, which might be one of the reasons why that's the case.
Just to interrupt there, sorry.
Sure.
I mean, just to say, it depends what profit you want and how you're sharing that profit. So profitable to whom? You may have just seen a bit of research released by the Office of Health Economics showing that if everyone in the UK adopted a plant-based diet or a fully vegan diet, we could save 7 billion in healthcare costs. So we would have a saving that could be reinvested in areas that could have a greater impact. So yes, there's profit for some, but there's a lot of lost revenue on healthcare conditions that could have been prevented.
Yeah, I think 7 billion probably understates it, to be perfectly honest. And in terms of measuring suffering, the amount of suffering that can be reduced through these changes, it's absolutely huge, isn't it? But it's harder for pharmaceutical companies to make profits out of these areas. And I guess there's maybe conspiracy theories abound around that. So, okay, and, what do you think then of the kind of current dietary advice that's given to patients who are suffering with cancer and diabetes? I mean, in the kind of studies that I've seen, or the understanding that I've seen, or some of the more lifestyle approaches, doctors from the US that have commented on cancer. One food in particular which is seen as problematic is dairy. And yet in our hospitals, where in cancer wards, etc., dairy seems to be quite prolifically provided since it's a good source of protein. So what do you think of the current dietary advice that's given to patients suffering with cancer, first of all?
Well, I personally wouldn't pick upon dairy as something, either good or bad, and maybe we'll come back to that. I mean, if I was going to vilify a food, I would say processed meat because it's a group 1 carcinogen and actually it directly causes cancer, and that's public knowledge as of 2015. But I would say that
it's actually classified now as a group 1 carcinogen.
Processed meat is, things like bacon and sausage and salami and ham and what have you.
Is that 1A or 1B? It's
1A. 1A. It causes cancer in the same category as tobacco, asbestos,
Wow.
So if I was going to get one food out of the hospital, which I really want to do, and we were going to do some campaigning around it this year, it really would be processed meat. But just coming back to the guidance for cancer, I think the guidance is very solid. We've got very good recommendations from the World Cancer Research Fund that states within its 9 recommendations for cancer prevention and living well after a cancer diagnosis that we should center our diet around fruits, vegetables, whole grains, beans, nuts and seeds. Obviously, it doesn't say exclusively, but it says predominantly, and it says, eliminate or reduce processed foods, sugar sweetened beverages and red and processed meat. So I think the guidelines are very sound, but I'd be surprised if many people, and we know this from survey data, actually sort of realize that those are the foundational guidelines for cancer prevention. I think the trouble comes with the food environment because we don't really make our food choices that consciously, and you just have to look around you, and we're selling the wrong types of foods or serving the less healthy foods on menus. And of course, in hospitals, people go to foods that they recognize that are comforting to them. And so I think it's more about the food environment. I think as clinicians and physicians, we know that healthy plant-based foods are good for people recovering from cancer. As I say, I mean, I don't consume dairy, you don't consume dairy. 70% of the world's population are lactose intolerant. It's not a relevant food. We can get all the nutrients from better sources. And that's what I talk about with my patients, that, we want to make the best choice possible. And if you compare dairy consumption to something like soya milk and tofu, you can increase the health promoting properties of your diet just by swapping out. I think the data on dairy and cancer is mixed. Dairy consumption lowers the risk of colorectal cancer, but it's purely because of the calcium content. So having calcium from other sources or supplements will have exactly the same effect. But I guess as a British society, we've got used to having quite a lot of our calcium intake come from dairy sources.
So, sorry, Shireen, are we saying there then that, say somebody who's on a vegan, plant-based type of a diet, who has colorectal cancer, they would be better served by consuming dairy?
No, I didn't say that. I said that there was an association between the consumption of dairy because of its calcium content and a lower risk of colorectal cancer. These studies are not done in people who are following a vegan diet. I mean, as you know, vegans are less than 1% of the global population in general. So this is overall population-based data. So I don't think we can say, good or bad for dairy. Dairy has a negative impact on prostate cancer risk, for example. So it increases the risk of prostate cancer. So it's kind of one of these foods that you could do better with, you do not require. Its production is harmful for the environment, and we can make much better choices and get our nutrients from beans and greens and lots of other plant foods. So, but if I was going to improve hospital food, I would definitely focus in on the red and processed meat. And I think the thing is, there's a lot written in guidelines. Even our UK dietary guidelines, they're quite permissive to a plant-based diet, but actually less than 1% of people actually follow this guidance and are meeting the nutrient requirements of the Eat Well Guide, which is our British guideline. So I think it's one thing having guidelines, but it's the other thing about making the food environment conducive for people to allow them to make the right choices, making food accessible, affordable to all.
Yeah, I mean, that's one reason why I think about hospital environments when somebody is in hospital. I mean, that's an opportunity to, surround them with good options, or give them, give people options that they wouldn't necessarily be familiar with at home, or be willing to try. Okay, I mean, one thing that's frustrated me, I speak to many people with type 2 diabetes. I think it's a kind of an easy win in terms of a dietary change and seeing results very quickly. And in fact, one of our DJs here, Sumaraji, who's had type 2 diabetes for quite some time now, quite a number of years, who made some changes to her diet, moved more towards a plant-based diet, moved and also moved more towards fruit as well, which is one of my recommendations to her. Now, at the same time, she's being told by medical professionals that she really needs to control fruit consumption, carbohydrate consumption in order to tackle her diabetes. Fortunately, she experimented enough to realize that the fruit didn't spike her blood sugars. She's now got a continuous glucose meter that she wears. And because she'd had that slight experimentation, she's experimented a bit further. And now sometimes has and is wanting to try complete days of just consuming fruit because she's seen how positive it's been for her. So these kind of things frustrate me terribly. Can you comment on that, about that kind of dietary advice that's given to diabetes patients?
Yes, I think that's really excellent to hear about your colleague's transformation, and congratulations to her.
She looks amazing. She looks
Wow.
phenomenal. She's lost years, quite frankly.
Yeah, it's amazing. I think, there's many ways to tackle type 2 diabetes. So on the one hand, there's prevention, and that's where we need to, put a lot of energy, because 1 in 10 people over the age of 40 years in the UK has type 2 diabetes. And the stats are only getting worse. 1 in 10 people over the age of 40. And of course, we know South Asians, like you and me, get the condition at 2 or 3 times the frequency and about 10 years younger than a white person. So we really need to tackle prevention. And here we know that the key foods associated with the lowest risk of developing future type 2 diabetes are fruits, vegetables, whole grains, beans, nuts, and seeds. So a healthy plant-based diet. And in part, not exclusively, but in part, that's because it supports a healthier weight. Because ultimately, type 2 diabetes is a condition due to chronic calorie excess. Doesn't really matter what calories are coming in excess. It is an excess of calories that then gets converted into fat into your body and lays down in the body organs like the liver and the pancreas and the muscle and makes you insulin resistant. Now, you may have heard from other experts that actually an individual's fat tolerance varies. So, I may only have to put on a stone in weight and I become diabetic, whereas you might see a 30-stone individual who doesn't have diabetes. So everyone's fat threshold is different. Unfortunately for South Asians, again, we have this predilection for laying down fat in our body organs, even if we're not outwardly carrying excess fat under the skin, the less problematic fat. So prevention is clear cut. If you eat a predominantly plant-based diet or exclusively plant-based diet, you will have at least 50 to 60% lower risk of developing diabetes in the future. Now, when it comes to treatment of established diabetes, like perhaps your colleague, it gets a little bit more muddied because any form of weight loss is going to help. So if you lower your calorie intake, for example, a bit like the NHS approach, the NHS have adopted the meal replacement program, where you get about 800 calories a day in the form of meal replacement shakes. You'll lose weight because you're having less calories, you'll lose weight. And the studies have shown that people who lose at least up to 15 kilograms will virtually all reverse their diabetes. So weight loss by any means reverses your diabetes. But I guess the question that we need to ask is how we do that in the long term sustainably so that we don't end up in the same situation again. And here is where plant-based diets come to the fore. They're full of healthy foods, fiber rich, avoids all the inflammatory compounds, the carcinogenic compounds, and is associated with remission of type 2 diabetes. I think when it comes to the lowering carbohydrate approach, again, people tend to lose weight because they're cutting out the unhealthy carbohydrates like the refined grains, the sugars, and that will support people to lose weight. So most of the impact is from losing weight. But in the longer term, if you're replacing carbohydrates with animal source foods like meat, dairy, eggs, and animal sources of fat, so the saturated fat, you will increase your long-term risk of cancer and cardiovascular disease. And so that's the concern. So I hope that makes sense to some degree.
But there are, I mean, as it stands today in the treatment of diabetes, there are medical professionals out there who might even recommend a ketogenic diet. And also, there's many health professionals out there who are talking to patients that I speak to who are saying that really fruit is, one piece a day, it's not your friend, et cetera, et cetera. Yet we're seeing across the board pretty much that people who are type 2 diabetic, who are checking their blood sugars daily or regularly or have a continual glucose monitor, the consumption of fruit reduces their blood sugar spikes. The removal of dairy absolutely has a dramatic impact in the first days, Shireen, has been our experience. Literally from one day to the next, there's a dramatic drop in blood sugar. So there's not been a chance for weight to be lost in that time, yet we're dramatically improving their glucose sensitivity just by the removal of certain foods and the inclusion of things like fruit.
I agree. And I think we can't put carbohydrates just in one category because there's lots of different types of carbohydrate. Healthy plant foods are predominantly made up of carbohydrates. So telling somebody to cut out carbohydrates asks them to remove the healthiest foods on this planet, like fruits, starchy vegetables, beans, whole grains, and replace them with foods that we know are less healthy. I think people vary based on like which foods give them sugar spikes, but I personally don't think that we need to get hung up on that. I think we need to center our diet around foods that are healthy, that supports a healthy weight, that are fiber rich, that supports insulin sensitivity, and a plant-based diet covers all of that. So I think it is simple, but we have to recognize that there's different ways of showing the same thing. So you could probably bring on a low carb advocate and they'll tell you exactly the same about a patient who's lost weight and reversed their diabetes by just cutting out refined carbohydrates, which may work as well. But I think we need to be thinking about healthy, sustainable diets that will keep people well in the long term, alongside putting diabetes in remission. I'm
not sure if you're as shocked as I am when I hear that doctors are, more keen to recommend a ketogenic diet than a more plant-rich diet for type 2 diabetes. I feel utterly like it's a misreading of the research, and I do wonder where that comes from. I'm glad that your organisation exists to kind of educate health professionals on the research that's out there. So you are a hematologist with a special interest in the treatment of lymphoma. How beneficial is a plant-based diet in preventing and treating cancer?
That's a broad question, and there's there's several hundred types of cancer, so it's a bit too broad, really. If I just hone in on my specialty,
in terms of your specialty, sorry, I should have said that.
So lymphoma is not terribly preventable, but as I say, I think the benefits of a healthy diet and lifestyle for people who have a diagnosis of lymphoma comes with preventing other comorbidities, cardiovascular disease, type 2 diabetes, cognitive problems. Because, of course, we've been hugely successful in treating quite a lot of the common lymphomas, and many people are cured and will, live long lives. However, lives are shortened by the complications and the increased risk of other conditions like cardiovascular disease and type 2 diabetes and second cancers. So the diet and lifestyle piece for me falls into keeping people well so that they can get through treatment, and then adopting healthy lifestyle habits that will prevent other chronic conditions that they are at higher risk of. And there are emerging data to suggest that a healthy plant-based diet can support people recovering from certain common side effects of cancer treatment, such as fatigue and brain fog and so forth. So I think there's lots of positives for lifestyle medicine approach for my patients, but my cancers wouldn't come under the sort of usual preventable cancers, where the common cancers are the ones that we're sort of mostly looking to prevent, such as colorectal cancer, breast cancer, prostate cancer, and lung cancer, which obviously is mainly related to tobacco smoking.
Have you seen much about the treatment of people who've treated cancer with lifestyle approaches alone?
So I think
I would be one of those examples, as it happens.
yeah, interesting. Well, I'd love to hear your story and more in full, but I think there are limited data on treating certain early stages of cancer. So you'll know the founding father of lifestyle medicine, Dr. Dean Ornish. One of his seminal studies was in a group of men with early stages of prostate cancer. So he randomized 93 men who had early stages of prostate cancer, who didn't need any medical treatment, to either his lifestyle approach with all the 6 pillars of lifestyle medicine and a plant-based diet, or compared to a group that didn't change and just followed their usual sort of physician advice. And he was able to show that you could slow down the progression of prostate cancer by adopting a healthy lifestyle approach, and he was able to show what was happening in the body at the same time. In a different group of people, you can lengthen the telomeres, so the caps at the ends of the chromosomes. You can change gene expression. So that's very exciting, and I think anyone who wants to prevent prostate cancer or already has a diagnosis of prostate cancer, there's enough evidence out there for me to say you really must adopt a lifestyle approach, and it will probably slow the progression and hopefully support, longer, healthier living. So I think for that cancer, there's quite a lot of information out there. I haven't seen lifestyle medicine replace what I would call conventional cancer treatment, and certainly not in my field. There's been the odd case report of people that might have improved or put their cancers in remission. But as an overall, there aren't strong data that you can actually use a lifestyle approach to treat cancer instead of the pharmaceutical surgical approach, where we do have a lot of studies.
I mean, what about with regards to fasting? I mean, I know there's the research by Walter Longo around post chemotherapy fasting in terms of bringing the immunity back for the treated individual, but also I'm aware there's places like True North Health Center in in California which have also successfully treated people with cancer with a fasting only approach.
Yeah, I've only seen case reports. I've seen one patient, a publication on one patient with follicular lymphoma. I agree that fasting may become a reasonable additional approach to add to standard chemotherapy. Walter Longo, from what I've seen, is only published in people with breast cancer. So we would need many more sort of different types of cancers studies, including, of course, for my specialty as well. I think in that study, although there were some positive benefits, many people weren't able to stick with the fasting regimen in certain cancers where weight maintenance is a problem. You might run into problems if you're not consuming enough calories. So I think it's nuanced. I think it's very interesting. Some people might choose to add fasting in with their treatments, but I think it has to be done with the support of health professionals and with medical supervision, like you would get at the True North Health Center in the US.
I mean, so from what you're saying, you see all these cancers as very different in terms of the disease and the treatment of them. I know that there's another worldview is that you bring health to the body, and the body's doing this magic all the time of curing things that are going on. We've got cancer, all of us have got cancer cells within our body, right? It's keeping us alive, it's digesting, it's doing 1,000 different things. And if we just bring health back to the body, it can do remarkable things in terms of healing us as well. But you seem to be of the approach that cancers are very independent of each other. They need to be treated individually or independently. Am I right in saying that?
Yes, to some extent. I mean, as I said, there's hundreds of different cancers. Just in lymphoma, there's over 40 different subtypes of cancer. So it's very difficult to generalize. I treat lymphomas where people would be dead within a couple of weeks. You don't have time to institute lifestyle approaches instead. Burkitt lymphoma is the fastest growing cancer known to man, so you don't have time to just fast it into remission. So I think it is very different, but I think all cancers and all people with cancer can benefit from instituting lifestyle medicine approaches and adopting a healthy diet in line with the recommendations, which is predominantly plant-based. But I don't think we're at a stage where we can say that all cancers will be put into remission by a lifestyle medicine approach, because they do all behave in different ways, and even the same cancer in a different person could behave in a different way. So I don't think it would be correct. It's not correct to say that we can just replace conventional medicine in cancer
care.
No,
we're not there yet at all, are we?
Yeah. I mean, I might say that for type 2 diabetes, but I'm not going to say it for cancer.
Sure. Okay. Okay. So, for which diseases and conditions then would you say is lifestyle medicine most effective?
Yeah, good question. And I think it comes down to the cardiometabolic risk factors and the diseases. So plant-based diets are excellent at maintaining a healthy weight. They're great at keeping blood pressure within normal limits, keeping your blood lipid, like your cholesterol, at a healthy range, glucose regulation. So we've talked about that. So preventing type 2 diabetes. And I think those are the main things. And I think if that's the minimum it can do, that's amazing, because heart disease, cardiovascular disease is the top killer of men and women around the globe. So I think that's where plant-based diets come to the fore. Now, there's definitely benefits for preventing a cognitive decline. So that's dementia, because what's good for your heart is good for your brain. Dementia has all the same risk factors as cardiovascular disease. So there's certainly a very big piece of using lifestyle medicine to prevent dementia, and 40% of cases of dementia could be prevented if we address lifestyle factors, but also socioeconomic factors such as education and so forth. So I think those are the main conditions I would talk about, but there's a lot of benefit to be brought to other conditions, so inflammatory conditions such as arthritis,
lupus,
I mean, we've in our group, and you'll read on our website under the patient stories, we've got a number of case and studies of people who've reversed their type 2 diabetes. Type 2 diabetes, yes, but arthritis, who've supported their health with multiple sclerosis, so all that sort of inflammatory autoimmune condition. I think there are definitely benefits to be gained there, and that's certainly present in the published literature. Whether everyone can get off their medication, probably not, but a vast majority of people can significantly improve their symptoms and reduce their medication use in that sort of inflammatory autoimmune category of conditions.
Yeah, I mean, there's some remarkable research by Dr. Roy Swank around the treatment of multiple sclerosis back in the 70s. Again, something that seems to have been overlooked largely in the treatment of multiple sclerosis today. Yeah. And I mean, again, these things kind of trouble me very much, Shireen, because there's so much suffering behind the lack of appreciation of the work that's already been done. Some 50 or so years ago by Dr. Roy Swank. And we actually interviewed Dr. Brooke Goldner, who suffered with lupus herself and was able to transform. I mean, she was able to come off of all traditional medications. She was able to reverse in her words, reverse her condition by adopting a plant total diet, which included a lot of raw foods, and also treats many patients with inflammatory diseases very successfver
Yes, I'm aware of her work, and she's doing wonderful things. And just to mention about Roy Swank, I think I wouldn't overlook the fact that the Overcoming MS program, I don't know if you've heard of it, it's a massive global patient support group that really adopts many of the principles of the Swank diet alongside healthy lifestyle behaviours. So that is readily available to people living with multiple sclerosis, led by a neurologist, if I'm not mistaken, in Australia, but as I say, it's global, and and definitely a few of the people in my group as members are part of the Overcoming MS program.
I can't recommend it enough, actually. I mean, and I think they actually adapted Roy Swank's diet because Dr. Roy Swank utilized fish oil, which was beneficial at the time, and they actually use algae oil now today as a
Yeah, I mean, the
better
OMS program is not fully plant-based, but it is a plant-rich diet. Roy Swank was also not a fully plant-based
No, he
diet.
wasn't.
He was mainly inquiring about lowering saturated fat intake, which of course is easier on a plant-based diet, but it wasn't exclusively plant-based, his approach, but still had remarkable results. And OMS is predominantly plant-based, but it is not against the consumption of fish. But if you're not eating fish, then algae oil for sure.
So what is the recommendations with OMS now in terms of saturated fat levels? Is it 10 grams, 15 grams per day?
I think it will just be in line with what's already recommended, that 10% of your diet or less, or the fat intake should be from saturated fat. But effectively, they're recommending a plant-based diet with the optional addition of fish. And if you're not eating fish, then getting your omega-3 fatty acids from algae supplements.
Yeah. Okay, good. Yeah, if I remember, so the saturated fat level is so low that you would have to avoid largely animal foods in order to achieve it.
Yeah,
You could have
sure.
a little bit. I think a little bit of cottage cheese here and there was recommended, if I remember correctly. Okay, and so which diseases is lifestyle medicine not appropriate for?
Wow. Acute infections, such as, salmonella, diarrhea, or upper respiratory tract infection with mycoplasma or so forth. So, acute things, accidents, infections, those sort of things. But, we even know through COVID that a healthy diet and lifestyle and a plant-predominant diet resulted in lower risk of getting COVID and lower risk of severe COVID. So never say never, but, there's some acute conditions that really need medical intervention first and foremost, and then probably adoption of the healthy lifestyle behaviours.
Sure. So you're saying then for any chronic disease, then a lifestyle approach makes sense, and a plant-based diet makes sense.
Totally. I can't think of a reason why you wouldn't want to adopt the 6 pillars of lifestyle medicine, because there's evidence for supporting physical and mental health and well-being, which we haven't touched upon. But we know that a healthy plant-based diet is optimal for brain health and for emotional health, psychological health.
I think just a lot of people out there will wonder, where do I get my protein from? And these kind of questions will come up. I mean, what would be your answer to the protein question, Shireen?
Yeah, my slightly flippant or facetious answer will be, well, largest land animals on this planet, the elephant, the giraffe, all herbivores. They manage to get protein from plants. We can do the same. But a science-based answer would be all plants have protein. So some have more, some have less. So, if you're planning an appropriate plant-based diet and including plant sources of protein, such as lentils and beans and nuts and seeds and chickpeas and soya, which would be abundant in the usual South Asian diet, let alone other traditional diet patterns. And protein is not an issue. I think one mistake that people make when they switch to a plant-based diet is perhaps not consuming enough calories, because you do eat more volume because the food is naturally lower in calories. And I think sometimes that can contribute to some fatigue or people feeling that they don't have the energy. But I think largely most people don't need to worry about protein needs unless they're in a special category like elite athletes, and you have to plan your meals like you would on any diet pattern to make sure you're meeting all your macro and micro needs. And sometimes in older people need a bit more careful planning, but outside that, it's very easy to get enough protein and other nutrients.
Okay, jolly good. So we touched on this earlier on, but so why do South Asians suffer such high rates of chronic disease when compared with Caucasians in the UK? Is it the food? And also, do vegetarian, vegan South Asians have different rates of chronic disease than omnivorous ones? I've not seen that data broken down. You mentioned with terms of type 2 diabetes that perhaps the South Asians have lowered capacity to carry as much fats, which is why we may suffer higher rates of type 2 diabetes. But there's also chronic kidney disease where South Asians suffer with very high rates, which might not be in my mind, might not be so closely related to fat stores in the body.
Well, it is, in that the most common reason for chronic kidney disease is hypertension and type 2 diabetes. That's the bottom line. So for most people, those are the causes. So again, it does come back to
Okay,
diet
it
and
does.
lifestyle. So I think as South Asians, we definitely have the gun loaded against us when it comes to genetics. So there are some high risk genetic factors that mean that we have to work harder to prevent these chronic conditions. It doesn't mean it's not possible, and there are the data that you talked about. So if you look up the work, the results of the Masala study, so it's a US-based study looking at health outcomes in South Asians in the US, and it's looked at dietary factors, dietary patterns, and just I think it was last year published a paper looking at health outcomes for South Asians following a healthy plant-based diet. And those following a less healthy plant-based diet, and showed that, if we optimize the diet in the way that we've talked about, centered around whole plant foods, minimizing ultra-processed foods, then, we can significantly reduce our risk of overweight, obesity, carrying the fat in the wrong places, and type 2 diabetes. So that data is out there. Using the terms vegetarian and vegan don't necessarily tell us what an individual is eating. It
Sure.
tells us what they're not eating. And so we know that South Asian diets, particularly in the UK, are high in unrefined grains, even white rice, white flour, high in sugar, and as you say, do contain significant amount of dairy. Some people do eat eggs as well. So it's all about diet quality in the foods that we're going to eat. So there's no reason why South Asians cannot benefit from a healthy plant-based diet in the same way as has been published in the literature. But I think we just need to work a bit harder, and there's a little less leeway to sort of around the edges to be including the unhealthy foods, because of the fact that we are genetically a bit more predisposed to these other conditions. So, when you look at the BMI, and I know that there's problems with body mass index, but in Asians, a BMI of above sort of 21, 22, you start running into problems, which is why we should be aiming to have, a lower body weight, and certainly in the lower range of the BMI, plus paying attention to diet and lifestyle habits. In the UK as well, South Asian women are some of the most sedentary. Physical activity isn't part of our everyday. I've had to work at it. If you don't already know, that there's a campaign called Running on Plants that finally got me doing some physical activity in the last year, a bit more than I was doing on my dog walk. So, there's a lot of factors that play into it. And then we do have to recognize the importance of socioeconomic factors and the disparities in health outcomes based on people's financial economic means and what they have access to. And we know that people of colour are very much more disadvantaged in the UK than white counterparts.
I asked this question to Dr. John McDougall, and suggested to him that was it down to genetics, and he called me a racist. He called me a racist. He said actually what it is that South Asians have probably grown up in an environment where there was just naturally more plant foods, over generations, and now we move into the West, and suddenly disease rates go beyond that of the home population, Caucasian white people, because simply genetically we've not adapted to consuming poorer foods. I wonder what you think to that.
Well, but then it sort of does come down to genetics, doesn't it? It's about
it's true. It does in a way.
How we've evolved. We've already talked about the fact that at a lower BMI. So for a white person, a BMI of 30, you may still be okay and not have laid down the fat in your organs. But we know for a South Asian, a BMI of above 22, you're going to start potentially running into problems. Not everyone, but so we have to work harder at it. I agree that we can obtain the same outcomes, but we need to work harder at it. We need to start earlier, because these conditions occur 10 years earlier. And I don't think that can be fully explained by just looking at the foods that we consume. But I agree. I think the benefits up for grabs are equally powerful, regardless of your ethnicity.
Okay, good. So Which common foods would you encourage people and patients to consume more of?
In the UK, it's got to be beans or legumes. We just don't eat enough, do we? Other than baked beans. It just doesn't seem to be part of what we do. But when you look at the longest lived populations, which you will have done, the blue zones, the key source of protein and key to each of these diet patterns around, in the blue zones is the consumption of beans. So I'd definitely say that we just do not eat enough. So, replacing the meat with beans or lentils or chickpeas, I mean, it should be easy for us as South Asians. But I think people from an Indian background are not consuming enough beans. And then that second to that, I don't know, it's a difficult one. I might choose three things. Nuts, a portion of nuts every day. So powerful.
Phenomenal for your heart health, apparently. It's like, a handful of nuts is the equivalent of running a marathon, apparently, a week or something, isn't it? So.
I can believe that. It truly is like the same as prescribing a medicine. I mean, so just a handful doesn't have to be expensive when it's just 30 grams. And soya foods, I think we're just not sort of considering soya as a really healthy addition to any diet pattern. Doesn't matter what your baseline diet is. If you add in soya foods like tempeh soya milk, edamame, even some of the soya mince products, you can really increase the quality of your diet and get really healthy nutrients. So I think those would be my top tips. Although soya is a legume, although people don't talk about it as it. So it's really just two top tips.
I mean, I'm now. I'm giving away my age here, but I've moved into my late 40s, and so a lot of the ladies that I know are going through the menopause or have been, have already started going through the menopause, and wow, it's problematic, to say the least. I think I saw some research on your website around the consumption of soy and the benefits for ladies who are menopausal. In terms of affecting hot flushes and the like. Can you give us a bit more information around that?
Yeah. So just very recently, Neil Barnard published his randomized study in people who were menopausal, suffering with hot flashes. And it was a randomized study, I think it was a crossover study, with the intervention arm, a plant-based diet with 3 portions of soya a day, and compared them to the conventional diet. And he was able to show that in people eating the plant-based diet with extra soya portions was able to reduce the severity of hot flashes by sort of over 80%. So really, really helpful. And that research is sort of underpinned by observational data. People eating a plant-based diet seem to have less of these troublesome menopausal symptoms. So absolutely. And then if you take into account the benefits for heart health, bone health, reducing rates of cancer, it's a no-brainer for, to be honest, men and women.
I mean, a lot of people kind of want to steer away from soya because there's an idea out there that in men it's feminizing or it's highly estrogenic. Something I've battled with on a few occasions. What would be your thoughts on that?
Yeah, I mean, it's just one of these myths that just never dies. It never dies. I wish it would. But you only have to look at reputable sources like the British Dietetic Association, our website, the main researcher in the world, Mark Messina. There's review after review after review demonstrating that is not the case in humans. And the only health outcomes that have been shown for humans eating soya are benefit, for all the reasons I've said, heart health, reducing rates of cancer, bone health, menopausal symptoms, reducing rates of prostate cancer in men. So there's no foundation for that. I think probably the waters have been muddied by the dairy industry, who don't want us to be swapping over to soya products instead of their dairy ones.
Yeah, and in fact, we've seen another fight recently with soya milk not being able to be called milk or being referred to as a drink,
Yeah.
which
Well, any of the dairy alternatives, not and yeah, and veggie burgers not being able to be called burgers. I mean, it's just an industry tactic, isn't it? But it's draining of energy when you have to keep fighting against these things. I mean, it's if people don't know when they go into the supermarket that they're buying dairy or soya. I mean, it's quite obvious to most people.
and it's true. I mean, within soya there is estrogen, but it's phytoestrogens, which are plant-based estrogens, which
Yeah.
are effectively, from my understanding anyway, you can correct me if I'm wrong here, are adaptogenic in the body. So they will adapt to what you require. But then often the people who are saying that soy is bad for you will be consuming dairy, which is rich in mammalian estrogens, which will be absorbed absolutely as hormones within the body. Am I correct in thinking that?
Yeah, absolutely, absolutely. So plant estrogens are very different from the way that sort of animal-based estrogen compounds work. So yeah, I think, we can often be fooled by sort of laboratory or animal experiments. Therefore, that's why, when it comes to diet and nutrition data, we just need to look at the human data because we are different from the lab, the test tube, from rats. We handle compounds and foods in different ways, and we've got a lot of human data to support the benefits of consuming soya.
Okay, great. And as I mentioned, we are a South Asian station over here at Fever Radio. You're a practicing Muslim.
Yes,
Yes.
yeah, I am Muslim by
And
background.
and so and you're vegan as well. And so I've had this question come up from our listeners before. What about during Eid? The traditional kind of sacrifice of the lamb as part of giving of charity and alms. How do you manage that?
Yeah, it is difficult, isn't it? But I think, traditional traditions and cultures change. It's quite clear to me that Prophet Muhammad has said to treat all animals with compassion. There's absolutely no doubt about that. And, in the current day and age, we can give of alms in very different ways. It doesn't have to involve the death and slaughter of an animal. So we can recognize that it was a tradition, but we can absolutely change our traditions to be in line with our ethical and moral compass.
Okay, great. Fantastic. Thank you so much for the time that you've given me today, Shireen. As I say, I've since I returned to the UK after the cancer diagnosis, and kind of on a charge to try and get the information out that I knew to people in order to hopefully reduce suffering in the world. I've been frustrated at the fact that there's such little knowledge around the health benefits of a plant-based diet, particularly amongst medical professionals. It's been a real frustration of mine. And even when I started working on the radio station and trying to do interviews like this, there was very little out there in the way of information that I could use to support me in those discussions with medical professionals. What you're doing at Plant-Based Health Professionals is a game changer, really, to this. And just the list of doctors that I've been able to speak with who profess so well the learnings that they've garnered from it. It's been absolutely fantastic. I mean, what would be your message to any medical professionals, and there will be quite a few who are listening in to this interview? What would be your message to them?
Yeah, well, thank you for the kind words, and I hope that I'm going to be reaching people who haven't heard of us in order for them to at least just look up the website, look up our resources. We've been very careful to really put out evidence-based education in the form of textbooks, university courses, all sorts. So the information is out there. Just be a little open-minded, look at the information, and then use it to empower your patients. And I think, like with all of these changes in our society, it's often led at the grassroots level. It's patients like you who demand it of our health professionals. And, we can't but, follow the evidence and see in front of us the changes that people are making in their lives and having, great health transformation. So I think it's all up there for grabs. Have a look at all our free resources online. Join us. Join the movement. There's lots of us out there now, I would like to say. And if I've played a little part in that, then that's really gratifying.
I would say you've played a big part in it here in the UK. So thank you so much for that. Just before you go, how can people contact you, find you, reach you? What would be the best way to do that?
Best thing is through the website. So hopefully you'll just let people know. It's plantbasedhealthprofessionals.com, or the shortcut is pbhp.uk, pbhp.uk. We're on social media under Plant-Based Health Professionals, so you can find us on Facebook, Instagram, and Twitter. And yeah, you can contact me through that website. It comes straight through to my emails.
Thank you so much, Shireen. Shireen Kassam, consultant haematologist and honorary senior lecturer at King's College Hospital and founder of Plant-Based Health Professionals. Once again, thank you very much for taking time to speak to our listeners here at Fever Radio.
My pleasure.
Thank you.